In this video, we're going to continue talking about strengthening exercises for the posterior chain. Recall that the posterior chain is a group of muscles on the posterior side of the body, and from inferior to superior, they would be gastrocnemius and soleus, the hamstrings, the gluteus maximus, the lumbar paraspinals, in particular the erector spinae muscle, and then also the latissimus dorsi. These two exercises we'll be covering here are the prone reverse hyperextension and the prone hyperextension. Of the posterior chain, these two exercises mostly target the hamstrings, the gluteus maximus, and the lumbar paraspinals, and they are severely underutilized in the clinical setting. They are amazing exercises for the posterior chain. So for treatment/training, the first usage would be for strengthening the posterior chain for anybody that has a weakness in some component that I just mentioned. Also, for people involved in sport and competition, they're often used as accessory exercises for the deadlift and the squat. Remember, the three main powerlifting exercises would be the squat, the deadlift, and the bench press. And certainly these are not substitutes for training deadlifting and squatting, but for getting increased strength in those muscle groups, these exercises are fantastic. And then these are also useful exercises for treating low back pain. So once the severity of low back pain comes down and you're out of that acute phase where you no longer have that severe hypomobility and those spasms, then you need to start strengthening muscles. And more than likely, in somebody with low back pain, one or more of those muscles, the hamstrings, the gluteus maximus, the lumbar paraspinals, one or more of those is weak. And it probably contributed to the injury in the first place. And also, if somebody has chronic low back pain, again, more than likely one, two, or all three of those muscles are weak. And these are two excellent exercises. And you can also use these movements as a quick and dirty assessment of the strength of the posterior chain. You won't find this next statement in any systematic review or anything like that. But just coming from what I've seen, really anyone with a strong posterior chain should be able to easily do at least 10 reps of each of these. Now, what's the difference between the prone reverse hyperextension and the regular prone hyperextension? It's all in what part of the body is static or stabilized, and what part moves or is mobile. So over here on the left, this is a prone reverse hyperextension, sometimes just called a reverse hyper. You'll notice there that the torso, which is over the table, is static and stabilized, and then the legs are mobile and they move. Either way, you're going into hip extension as you bring the legs up. Now in the prone hyperextension, sometimes just shortened to hypers or hyperextensions, you can see that the legs are static and stabilized, and it's the torso that moves. So each of these two movements are opposites of one another. Let's explore each of these in more detail. Now, when you're performing the full prone reverse hyperextension, you're going to be extending at both hips at the same time. However, you may want to consider beginning with the regression of that exercise where you're extending only at one hip at a time and just alternating between sides. So to do this, you're going to be in prone with respect to your torso, and you're going to be bent over the table edge with your hip crease positioned at the table's edge like you see right there. And holding on with both arms and keeping the knees straight, you're going to extend at one of the hips and try to bring that leg to parallel. Then you're going to set that leg down and do it on the other side. And here I'm just alternating between left, like you see right there, and right. When you're doing the full prone reverse hyperextension, both hips are extending at the same time. You should also cue the person doing this to contract the quads throughout the duration of the movement because that's going to keep the knees straight through the duration of the movement. You can also see here that after each repetition, I'm slowly letting the legs down rather than just dropping them. So I'm doing it with control. Now another thing about reverse hypers is that when you do them with the knees extended, you're maximizing emphasis on the hamstrings. In other words, you're biasing the hamstrings. This is hip extension, and there's two major hip extensors, the gluteus maximus and the hamstring group. When the knees are straighter, you're biasing the hamstrings. You're still getting glute activation, but you're getting more hamstring activation than you would if the knees were bent. That being said, if you perform reverse hypers with the knees more bent, which we're not showing right here, you're actually minimizing the contraction of the hamstrings and maximizing the targeting of the gluteus maximus. Now, with the reverse hyperextension, the legs were mobile and the torso was static. With the prone hyperextension, everything's flipped. So now the legs are static and the torso is mobile. And this poses a problem because unless you have the legs held down firmly, the person's not going to be able to stay on the table or the mat or whatever they're doing this on. So we'll talk about that in just a minute. So the patient position is going to be prone with respect to the legs because those are going to be stabilized. And the person's hip crease is still going to be positioned at the table's edge. Now the person's going to be bent over the table edge with their torso hanging off, and the legs are going to have to be stabilized somehow. So they can be stabilized by another person or with a strap, as I show right here. So I got a strap wrapped around the table there, and then the legs will actually sit underneath the strap. And the strap helps to keep the legs stabilized in position. If you're not using a strap there or another person to hold down the legs, the person will likely just fall over the edge of the table, and that's not good. You can also perform the prone hyperextension with the Roman chair as shown right here. Most Roman chairs are like this one, where the legs are actually held at about 45 degrees relative to the ground. But there are some Roman chairs that you can get where the legs can be held parallel to the ground, very similar to what we just showed on the last slide and what we're about to look at now. Now, if you don't have a Roman chair and you're doing this for the first time on a mat table, the setup can be a little bit challenging, so let's go through it. So you'll start right here in the quadruped position with your legs held under that belt or under that strap that's wrapped around the table. Remember, that belt is going to be what holds your legs in place and stabilizes them. Then, if it's not already there, you need to get a chair or something in front of you to help you get into the starting position. So I'm moving this chair here. And then I can basically put both arms on the chair. This gets me closer to the starting position. And then I can move the chair away, and I'm like this. And I also recommend keeping your hands sort of behind your head. You're not pushing on your head, but this helps to bring your scapulas into a retracted position and holding them there throughout the duration of the movement. One of the things we don't want is excessive thoracic flexion. We want to keep the thoracic spine as extended as possible throughout this movement, and so keeping the scapulas in that position helps to facilitate that. So here it is in real time, beginning from the quadruped position. So I get into position using the chair, move the chair out of the way, put my hands behind my head, and then with control, I'm lowering my torso down like that. Using the gluteus maximus and the hamstrings to help extend my hip and bring my torso back up. Again, try to keep your scapulas retracted throughout the duration of the movement, and you can even contract your scapular retractors, so middle trapezius and rhomboids, to facilitate that. An interesting way that you can advance the hyperextension is by doing what's called a crucifixion hyperextension, which gets its name based on how the arms wrap around the barbell. Now the barbell is going to contact the back near the level of the superior scapula, never on the neck. That's a common mistake. The person's going to retract their scapulas throughout the movement to create what we call a meat shelf, which helps to hold that barbell in place. And then from there, you just do the hyperextension. A really good way to do this is on a Roman chair. Again, most clinics are not going to have a Roman chair, so usually this is going to be confined to a gym, which is also pretty handy because that's where the barbells are at. You can also do what's called a barbell hyperextension. This is more common. It's very similar to the crucifixion hyperextension, except the bar is held in a more typical pattern, as if you were doing a squat. But you still keep that barbell around the level of the superior scapula, never on the neck, and keep those scapulas retracted throughout the duration of the movement. So the progressions of these exercises really begin with the single leg reverse hyperextensions, where you would of course begin with just body weight, and then you can progress it in terms of weight by doing it TheraBand resisted, with ankle weights, slow eccentrics, or any combination of those. From there, you can do the full reverse hyperextension, where both hips are extending simultaneously. Again, same rules apply. Begin with no resistance, so just body weight, TheraBands, ankle weights, and slow eccentrics. Then the hardest one of all of these for most people is going to be the full hyperextension. Again, you'll definitely want to begin this one with no resistance, just body weight. And then ways that you can progress it from there would be to hold a dumbbell in the hands. Obviously, you wouldn't have your hands behind your head if you're doing that. The person could wear a weighted vest. They could do those crucifixion or barbell hyperextensions, and even slow eccentrics, and any combination of those. Now remember that the full hyperextension there on the far right is going to be more difficult than the full reverse hyperextension for most individuals. The major exception to that is going to be people with tree trunk legs, having a lot of muscle in their legs. Remember, muscle in general confers more strength. However, with lots of muscle, that weighs a lot, and that's still more weight to lift, even in spite of increased strength. And so those people may have a harder time with the reverse hyperextension because you're actually lifting the legs there. In the full hyperextension, the legs are stabilized and you're just lifting the torso. So keep that in mind as well. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.